Hello, my topic is dental pulp stem cells and maxillofacial reconstruction. Some of the challenging cases treated by oral and maxillofacial surgeons are the patients with acquired defects of the jaws following an ablative tumor surgery or trauma to the oral and facial region. Without adequate maxillofacial reconstruction, these patients often suffer from a disease quality of life which is related to impaired speech, mastication, deglutition, and aesthetics. So, giving back or restoring something someone has lost and thought it could never be restored is one of the best gifts one can give someone. Dental pulp stem cells in maxillofacial reconstruction is a thought which takes us further one step into the future. With this thought in mind, let's move into the presentation. The aim of this presentation is to highlight the importance of dental pulp stem cells, their isolation, and their application in maxillofacial reconstruction. Uh, In this presentation, we're going to see about the methods of isolation of dental pulp stem cells, sites of retrieval, uses in maxillofacial reconstruction, advantages, discussions, and conclusion. What are stem cells? These are specialized human cells that are able to develop into many different cell types. Now, what are dental pulp stem cells? Dental pulp stem cells are stem cells present in dental pulp which are mesenchymal in origin. We have lots of stem cells. Why do we prefer dental pulp stem cells in maxillofacial reconstruction? Simple, they are human stem cells. They have a high proliferation rate. They are multipotent. They are mesenchymal and they are easy painless and non-invasive to get. Sites of retrieval. Dental pulp stem cells can be got from the permanent as well as the deciduous tooth. In deciduous tooth, it is retrieved from the lower anteriors and from the permanent from the third molars. Out of other tooth, we select these tooth because it is the first and the last tooth to erupt. These have eye, rich and uncalcified dental pulp stem cells. Methods of isolation. There are three different methods of isolation of dental pulp stem cells from the pulp tissue. First method. Pulp tissue is digested with collagenase or lipase enzyme. Trypanized cells are isolated and they are plated in culture dishes. Second method, undigested dental pulp pieces are explanted directly into the petri dishes. Third method, dental pulp tissues are initially trypanized. Small tissue pieces are explanted to the petri dishes for their outgrowth. These are cultured in minimum essential medium supplied with 20% FPS at 37 degrees Celsius with 5% carbon dioxide and 90% humidity in carbon dioxide incubator. Uses in maxillofacial reconstruction. In this, I'm going to tell about the uses of dental pulp stem cells in maxillofacial reconstruction and articles which supports it. First, an article by Emada Y. Ito K. Nakamura S. Yuda M. Nakasaka T. Titled as Promising Cell-Based Therapy for Bone Regeneration Using Stem Cells from Deciduous Tooth, Dental Pulp and Bone Marrow. It says that dental pulp stem cells are being used as stem cells for regenerative therapies for bone-related diseases and orthopedic surgeries. Another study by Aquina et al. Says that dental pulp stem cells are used in oral and maxillofacial bone repair. They have used dental pulp stem cells on collagen spawn scaffold, a scaffold which produces an effective biocomplex which can give an optimal support for regeneration of dental pulp stem cells in oral and maxillofacial bone repair. So the dental pulp stem cells instigate from the neural crest, migrate, differentiate and participate in morphogenesis and then give rise to the structures of craniofacial region including muscle, ligament, cartilage, bone, periodontal membrane and teeth. An article by Gracino et al. And Aquina et al. Assessed bone regeneration by dental pulp stem cells both clinically and radiographically using a collagen scaffold. Their results demonstrated that within 3 months of colonization on the scaffold, complete radiographic bone regeneration could be observed. Discussion. In this discussion part, according to Saber and Ong et al., dental pulp stem cells are preferred from the other stem cells because they are easily available. They can be preserved for longer periods and their frequent accessibility from the homogeneous resources and the relative lack of ethical and legal issues in its removal. Uh, D. Aquino et al. Says that the dental pulp is a remarkable site of stem cells. Collecting stem cells from dental pulp is a non-invasive practice that can be performed in the young after surgical extraction of wisdom tooth. It is a common surgical practice and tissue sacrifice is very low. Transplantation of new formed bone tissue from the dental pulp stem cells leads to the formation of vascularized adult bone and thus integration between the graft and the surrounding host blood supply. Dental pulp stem cells can be cryopreserved and stored for longer periods, and they are ideal for tissue engineering and for clinical use in several pathologies requiring bone tissue growth and repair. He also said that if bone marrow is the site for the first choice of hematopoietic stem cell collection, dental pulp must be considered one of the major sites for mesenchymal cell collection. To conclude, maxillofacial reconstruction using dental pulp stem cells is an amazing discovery in the field of biotechnology, which would make wonders when applied in reconstructing craniofacial structures after an oral and maxillofacial surgery. Thank you, my friends.